The state of Kentucky is being lauded for its rollout of the President's Affordable Care Act, or Obamacare as it's known. Our state, which is often ranked at the bottom when it comes to national measures, is right now at the forefront of a successful rollout of the plan. We're going to talk with the Secretary of Kentucky's Cabinet for Health and Family Services for an update, as well as take a look at something called e-health and breaking the obesity epidemic. Kentucky Outlook is next. Hello and welcome to this week's edition of Kentucky Outlook. I'm Barbara Deeb. On the program today, we go one-on-one with the Secretary of the Cabinet for Health and Family Services in the state of Kentucky. She was trained as a social worker. Audrey Haynes has spent her life in public service. She was appointed Secretary of the Cabinet for Health and Family Services by Governor Beshear back in 2012. Prior to that, she served in Washington, D.C. with the YMCA and has worked in the fields of mental health and substance abuse, along with something near and dear to my heart, literacy. Audrey Haynes joins us. Hi.
Thank you.
Welcome.
Thanks for having me.
You know, as I look at, you're appointed by the governor in 2012 to this position, and you know, there was talk of health care reform. There has been for decades. Did you have any idea to what you were signing on for, really?
I did.
Good.
I did have some idea about it because in Washington I had worked on the health care reform bill. I'd worked on pieces of it, so I was aware of it. I wasn't sure. I mean, I knew that the governor wanted to try to provide health care that was affordable and accessible and of the highest quality to as many Kentuckians as possible. So the Cabinet for Health and Family Services has a long reputation for not only being the largest cabinet in state government, the largest number of employees, but also it is one of the most challenging probably to manage. I was aware of it and I wanted to do it because I wanted to be a part of the change.
And change it is.
Yes.
And as we mentioned, you know, and we'll talk about that a little later in the program, but you know, often when you look at where Kentucky ranks with other states in national rankings, sadly, we're often at the bottom. But this is one where in the last several weeks, Kentucky has really shined, and shined because of the rollout of this Affordable Care Act, this affordable health care. And let's talk a little bit about that. What went into the prepping for this to ensure that that would be the case?
My goodness. Well, last year when I got here, we know that the Supreme Court had taken up whether or not it was constitutional. And so after the Supreme Court ruled that it was constitutional, and I think people don't understand that it was voted by the House, voted by the U.S. Senate, it was signed by the President, and then upheld by the Supreme Court, except for a very small portion of the law. And so after the Supreme Court said it was constitutional, then we went to work, and there'd been quite a bit of groundwork going on because we didn't want to wait to hear. We wanted to have a lot of preliminary research and background work done. So the governor said right then he wanted to create a state-based exchange. Each state has a very different and individualized insurance market. We have our own insurance companies, we have our own health status, etc. So he wanted Kentuckians to be in charge of our destiny with the health benefit exchange. And obviously it was a smart decision because we wanted to be transparent, we wanted to work with stakeholders, we wanted to work with our insurance carriers and insurance agents, we wanted to work with healthcare providers, and the only way we could do that and ensure that everyone was at the table is to have a state-based exchange. So as soon as the Supreme Court said yes, then we got our RFP out into the marketplace and waited for companies to say that they wanted to work with us and help us build our exchange. And so last year, about in October, the contract was given to Deloitte Consulting, and away we went.
And you know, she makes it sound so effortless, and then off we went. But you know, a lot really goes into that.
Yes.
And you know, it was a bid, so they won the bid.
Sure.
And so when you look at all the bad press that the president is getting right now for the national rollout of this plan, certainly that helps Kentucky's standing because it was, I'm not going to say flawless, and we can talk about that in a moment, but with few problems.
Right.
How does one go about then meshing all of this together?
Well, the first thing we had to do was find someone to be the executive director of the Health Benefit Exchange, of that office. And we chose the one person, I believe, in all of Kentucky that could have really done it. Her name is Carrie Banahan. She has been a lifelong public servant. She has worked throughout state government. She worked for the Department of Insurance. She has worked for the Department of Medicaid. She was the head of our Office of Health Policy. She helped to write our request for proposal that was answered by Deloitte. She helped to, she worked with me in the governor's office as we looked at the executive order to set up the exchange. She helped to write the early grants to the federal government for us to have the money to set up by the exchange, because all of this has been 100% federally funded. So we had to find the right person with the right set of skills, the right seasoning, and she is a absolute seasoned professional, and she is an excellent manager, as we see.
Okay, so the rollout occurred October 1st. That was the day. Kentucky was ready, and if I'm not mistaken, you were ready almost 6 hours before the actual, at 12:01 on that Tuesday, you were to launch the program, but it was ready to roll around 6:30 p.m. that evening?
Well, yes, we actually launched the afternoon before, and the reason we did that is because the way it was described to me is you do not want this big surge to happen at 12:01 a.m.
And could that be what was some of the problem with the national program? Everybody jumping in at the same time?
Well, I'm sure that was one of the problems. But so we didn't want that to happen, and we really didn't know what to expect. And so we decided around 6 or 6:30 the evening before, we would do a soft launch. And as the IT people described to me, that allowed it to stretch. So it's sort of like doing your stretching exercises prior to a workout. Okay. And it allowed the system to begin to stretch softly, because some people were going on to check. So it was getting a little bit of work before the 12:01, because at 12:01 there were a number of people that were waiting to go online. A lot of journalists mainly, but there was also a lot of people. I think a woman up in Ashland, Kentucky, with her insurance agent, was the first one to purchase the plan. So
there you go. Let's talk about that plan. First of all, we have, by 2012 census standards, 4.4 million people in the state of Kentucky, okay? We have 18% under the age of 65 who are uninsured, okay? Of that, 45%, just a little less than half, are rural, are considered rural, don't live in a metropolitan area. That having been said, you ask individuals to go online. A lot of these people don't have access to going online, so they have a plan B, so to speak, they can call.
Oh, we have so many Plan Bs and Cs, which is really great. That's another reason why having a state-based exchange, it was absolutely the way to go. Having nothing to do with whether the federal exchange was working or not working. I mean, we believe that had many of these states chosen the state-based route to start with, that their people would have access to the care and support within their state already, versus relying on a federal exchange, relying on someone from another state. When you call the 1-800 number for Kynect, you get people that are Kentuckians who are sitting in Lexington, Kentucky. They work for a company named Xerox, who received the bid to operate our call center. And so we've created 100 jobs already through that exchange.
So you're saying if someone is, okay, I'm at home, I'm a Kentuckian, and I'm going to go ahead and try to get on this exchange and figure it out. I could go on the federal system and call that number, but you're saying by calling the 800 number for Kynect, which is a big capital K with a small y, N-E-C-T.
Right.
And we'll put up a number at the end if you want more information. They get to someone in the Commonwealth.
Well, if people in Kentucky try to go onto the federal website or call the federal line, they will be sent right back to our website and to our number. So there's no need of even going there. It is better. We've been trying to just get people to call our Kentucky 1-800 number. And thank you for putting that up. Another way is that you can call that number and you can ask for someone in your community who is certified to assist you. And they will give you a list of people and or organizations. And we have several community-based organizations, faith-based organizations that are out there that have been certified, gone through training, and are willing to help people navigate the website. Also, our public health departments across the state, almost any healthcare provider in the state has gone through, some of their folks have gone through some level of training because they want people to sign up, because people who have not been insured, indigent care, this means that if I'm a healthcare provider in Kentucky, I'm now going to get some payment for these services, which is great. It's good for everyone.
You know, I saw you on a national show talking about how surprising it was that the majority of Kentuckians 50 and over, it surprised you how many were living without health insurance.
I'm shocked, and not only was I shocked at that, but I worked the call-in lines one night, and I was surprised. People were calling in, telling me their life story, and talking about how excited they are to have healthcare coverage. So many of them my age, I'm 53, so many of them in their early to mid 50s. There were at least 5 or 6 men and women who were saying, you know, this is the first time I've ever had healthcare coverage. And I was really quite taken back, because those of us who have been lucky enough to have healthcare coverage most of our life or all of our life, we take this for granted. We complain about the rising healthcare costs, but at the end of the day, we still have it. So not to have healthcare coverage, and for men or women, but especially for women, to be with all of our life-changing processes. You know, you have childbirth and then you menopause, and you know, women at higher levels of breast cancer and higher risk and so forth. You know, women need to have all of this preventative coverage. So do men, but especially women do. And so it really takes you back.
The realities.
Yes.
The realities. Okay, so let's break it down now. You're a Kentuckian, you call that number, maybe you've never had health insurance before, maybe you had a really good health care plan, but now because you're part of a small business, that small business is no longer going to be able to offer you that plan, okay? Which I've heard some small business people saying, that as a result of the implementation of this measure, they can no longer offer the good health care that they used to be able to offer to their to their employees.
Okay, well, let's talk about that for a second.
Let's talk.
That seems to be, Barbara, the latest aspect of the Affordable Care Act that's in the news. The president said many times, if you like your coverage, you're going to be able to keep it. And unfortunately, that was not completely 100% correct. It was around 95% correct, or 96%. So about 4% of Americans, that stands about the same percentage for Kentuckians who have individual policies, or they worked for a company who had the most minimum health care plan, almost a catastrophic plan that you could purchase. Their plans now do not meet the minimum standards of the Affordable Care Act. So when I hear these folks say, well, I liked my coverage and I'm never sick, but it was there for me. Okay, but you weren't probably able to go and get the kind of preventive care that you now really have complete and full access to you under the minimum plans that we're offering on the exchange. You have full access to those, plus no copays associated with any preventative care. And so they're going to get a better plan. The other big news for Kentuckians is that parity, mental health, substance abuse, and physical health, parity. And we know substance abuse is just a blight on our state, and it has taken the lives of so many of our friends, neighbors, and family members. And it really knows no economic boundary. But most healthcare plans in Kentucky did not have a very robust, if any, substance abuse coverage or behavioral health coverage. Now there is parity, inpatient and outpatient coverage, and beginning January 1, whether you're on Medicaid or you have private insurance, you are going to be able to access that coverage. So
Did you have some
fantastic.
input in lobbying for what would be included, or did you have to follow a federal mandate?
It was both.
Okay.
We had some choices. We had to look at, there were some guidelines about, we had to look at other plans that were being offered in our state. So there were some guidelines around that. There were some guidelines around substance abuse and behavioral health. And a lot of states already had substance abuse in their private plans, as well as they covered substance abuse for Medicaid. But in Kentucky, we did not. And so carrying substance abuse is huge, both inpatient and outpatient. So now we're working with providers all around the state trying to gear up for substance abuse, both inpatient and outpatient treatment and care. I don't suspect, having worked in the field of substance abuse early in my career for about 10 years, I don't suspect that there's going to be a lot of people that on January 1, they're like, oh my goodness, I've been wanting to go to treatment for that. Yeah. I think there's a lot of family members and friends out there that are saying, okay, if we get coverage, that is another hurdle we don't have to overcome. Because once you get someone ready for treatment and care, you cannot put them on a waiting list. And we've had such limited treatment and care in Kentucky that by the time that the waiting list, that they're ready, that their name comes up on the list or they're next, their motivation is gone. It's there instantly and then it's gone.
Quickly.
Yes.
What about adult children? So you've got a child maybe who's a student, and age 26 seems to be the golden number. So they get out of school, maybe they're in graduate school working on their PhD. They don't have a job, they don't have any money, they're 26 years old and they're required to get this health insurance. Then what?
They should go onto the exchange and they may qualify for Medicaid. Now, yes. So if you're off your family's plan, or maybe your family doesn't have insurance either, so you didn't really have a choice. I know a lot of college and universities have health plans that they offer to students. They usually have health service centers for immunizations and some preventative and sort of outpatient care. But now students, let's say you're 27 and you've gone through graduate school and that's sort of thing, but you have not gotten a job yet. You're only working part-time. You're maybe already back at living home with your family, which is the last thing you thought, but you need health insurance. You can go online to the exchange, and because you basically have very little salary right now, it is likely you may qualify for Medicaid, and that is associated with the poor and indigent. However, it is now a matter of your income, whether that you qualify for Medicaid or private insurance. It's all on the exchange. It's a one-stop shop.
Listen to her, good sales. But so the alternatives to Kynect are, let's say you have a private health insurance plan, you stay with that. Or you can decide, I'm not going to do this, and you're going to be levied a tax for not complying with the plan.
Yes, next year, and it will be through the IRS. So when you file your taxes, and it's around $95 or $100, $95 I believe it is, for the first year for not having insurance. So I believe, though, that we are going to keep working to try to get Kentuckians signed up. As you said early in the show, there's about 640,000 Kentuckians that are uninsured today. By our best guess and estimates and all of the data we have before us, about 308,000 of those will qualify for Medicaid, and the others it's private insurance. And of the ones that qualify for private insurance, we believe all but about 50,000 of those will qualify for a subsidy. And so if you have a private insurance plan, let's say, I'm just going to choose one of the companies. If you have Anthem, and you have an individual plan today, you can still go to the Anthem site, but in order for you to get your subsidy, and the insurance company, this is why it was so important for us to work together, in order for you to get a subsidy, you need to be able to go to the exchange site. But you can go, Anthem has it built in their site. You can come through them if they believe that you're going to qualify for a subsidy, and they want you to get a better policy, just like any of us, and for cheaper. So you will go through their site, it takes you to the exchange, you enroll, you choose your Anthem policy that you wanted, and you're sent right back to Anthem. So you can stay with the company that you like if you want to, but there are also other choices.
There are other choices. We're quickly running out of time. It's called Kynect. We're going to put up a telephone number if you want to get. As it stands, as we record this program, we are now into November. How are things faring? How are we doing in getting people to sign up?
Well, we're doing pretty well. I heard the governor from Connecticut on a morning TV program this morning, and here's a state that definitely has a larger population than us, and they only have 8,000 people enrolled. In Kentucky, and he's really proud of that, and I'm really proud of them as well. But in Kentucky, we have 32,485 folks that have enrolled in health coverage, Medicaid or private insurance in the state as of Friday afternoon, and we are thrilled. Beyond that, we have over 300 small businesses that have opened up an application process for their employees to go on and sign up. That's well beyond what our early estimate was. So we're enrolling about 1,000 a day. So we're thrilled.
Now, is there the January cutoff, as you say, when people file their taxes for the 2013 year? If they haven't, they're going to pay a $95 fee, a tax.
Well, that's not exactly true, because the open enrollment goes until the end of March. So it'll be coverage. So when you file your taxes in April, that will be for this past year, of course. So it will be the next April when you file your taxes. So sometime in 2014, we want you to have health care coverage.
But you're looking at the end of March as the deadline.
As of right now, that is when the federal deadline is. But if you qualify for Medicaid, you can go onto the exchange and you can be qualified for Medicaid any day, any month.
Good news. What do you anticipate is going to be the biggest hurdle before you? Because as it sounds very sunshine, everything's rolling along, thank you, but you have said one day at a time,
yes.
And that's a very pragmatic way to look at that.
Yes.
But what do you anticipate could be one of the bigger hurdles?
Well, as I said, with substance abuse treatment, we have to have more treatment offered in the state. So we actually have provider shortages, just like in other states. We don't have enough primary care. So we are, at the cabinet, we are eliminating as many barriers as possible for healthcare providers to practice within the scope of their license. So we're trying now to go through statutes, regs, to go through our whole healthcare system and the oversight of it. And so that is a matter of public health, behavioral health, Medicaid, Office of Health Policy, Certificate of Need. All of those agencies are working hand in glove to say, what else can we do to eliminate barriers to access to care? And so really, it is about getting people into primary care, to continue to encourage people to use their primary care versus emergency room, which is the highest cost care. So it's really around now getting people who are not accustomed to health insurance, getting them accustomed to utilizing the system.
Learning the system. You know, this hand in glove, this partnership, this working together, which sounds like it should have been that way all along, but it hasn't always been that way.
No, look, healthcare and the healthcare industry in our state, all across this country, it's big business. And we rely on them. We want them to have when you need healthcare, you don't care how much it costs, right? When you're sick, you don't care until you get the bill. And we know that it has completely devastated families. So the high cost. So it's going to take a while. This is all not going to happen overnight. As I say to everyone, we didn't get to where we are in this country with cost, with the uninsured overnight. It's taken us decades to be 44th sickest state in the country, so now it's going to take us a little while to crawl out of that. But I believe that with all of us better working together versus trying to put up obstacles along the way. And there's a lot of goodwill out there among providers and
that is key.
Yes.
We're just about out of time. eHealth, very quickly, which is the electronic billing that is taking place nationwide. Kentucky.
Electronic health records.
Yeah.
Yeah. So Kentucky, it's another place where we're a leader in eHealth. So it's your electronic health records. So when I go to the doc, I just moved here, moved back to Kentucky last year from DC. It was so great that my primary care physician in Washington could basically send through electronic health records my information to my primary care doc here. And so it is about, if I'm in Bowling Green, heaven forbid that I should have a car accident or something this afternoon, but I'm going to make every effort not to do that, Barbara. But as an example, I'll use myself, and I had to be taken to the Bowling Green Hospital. They could get my records very quickly if they were participating in the electronic health record network called the Kentucky Health Information Exchange. And again, Kentucky is one of the nation's leaders in getting our providers all signed up to participate.
And that, we could do another half hour on that in and of itself. We'll get you back here because
Yes,
we want to talk
thanks.
about the obesity epidemic in the
Yes.
state of Kentucky. But 44th ranking, we're working to get up there, aren't we?
We are. We're going
working on it.
to.
We're going to. And with you at the helm, I suspect we just might.
Well, thank
We've been
you.
talking to the Secretary for the Cabinet for Health and Family Services in the state of Kentucky about the Affordable Care Act and the rollout of Kynect. It's the big capital K, Kynect, and that's the healthcare exchange. That's going to wrap it up for this week's edition of Kentucky Outlook. I'm Barbara Deeb. We're glad you joined us.